Tuberculosis. You've probably heard of it, maybe in history class, maybe in the medical dramas. But what many people don't realize is that TB isn't just a disease of the past. It's still one of the deadliest infectious diseases in the world today. Let's break down what it is, how it spreads, and why it still matters globally. What is tuberculosis? Tuberculosis, or TB, is caused by a bacterium. It primarily affects the lungs, but it can also spread to the brain, spine, kidneys, and other parts of the body. TB spreads through the air. When someone with active TB coughs, sneezes, or even speaks, they release tiny droplets containing the bacteria. Inhaling just a few of these droplets can be enough to get infected. Here's something surprising. Not everyone who's infected with TB gets sick. There are two forms. Latent TB infection. The bacteria are in your body, but your immune system keeps them inactive. You are not sick nor contagious. Active TB disease. The bacteria multiply and cause symptoms. This is when TB becomes dangerous and even contagious. People with weakened immune systems, like those with HIV, diabetes, or those undergoing cancer treatment, are more likely to develop active TB. Symptoms of active TB include a persistent cough that lasts 3 weeks or more, coughing up blood or mucus, chest pain, weight loss, fever and night sweats, fatigue, and weakness. These symptoms develop slowly, which is one reason TB can go undiagnosed for months. Now, why is it still a global threat? TB remains a huge problem because of the three main reasons. 1. Global reach. In 2023, TB infected over 10 million people and killed more than 1 million, especially in low-income countries. It spreads most easily in crowded conditions in areas with limited access to healthcare. Number 2, drug resistance. Some strands of TB are now resistant to antibiotics, known as MDR-TB, multi-drug resistant TB. These strains are harder and more expensive to treat, and treatment can take up to 2 years. And lastly, number 3, underdiagnosis. Many people with TB don't know they have it yet, so they go untreated and continue to spread the infection. Now, can TB be prevented or treated? Yes, TB is both preventable and treatable. The BCG vaccine can protect against severe TB in children, although it's not widely used in countries with low TB risk. Antibiotic treatment, usually a combination of drugs taken for at least 6 months, can cure most TB cases if started early and completed fully. And public health systems are also use contact tracing, screening, and education to help control its spread. Now, even though TB is treatable, it remains one of the top 10 causes of death worldwide. It thrives in places where healthcare is limited, and with rising antibiotic resistance, the challenge is growing. So no, TB isn't a disease from the past. It's very much a disease of the present, and it reminds us that global health problems require global awareness and solutions.